Hello, I'm Dr. Jerome Burke of Bucksmont Gastroenterology. This short video will describe the process and procedure for colonoscopy, the test your doctor has recommended. Colonoscopy involves the examination of the colon or large intestine with a flexible fiber optic scope. The test allows for the removal of precancerous polyps and also helps your doctor in diagnosis of symptoms of abdominal pain, rectal bleeding, or change in bowel habits, both diarrhea and constipation. There are approximately 14 million colonoscopies performed each year in the U.S.
Colonoscopy is safe, effective, and well tolerated. Americans have a 6% lifetime risk of developing colon cancer. Colonoscopy is the best test we have for diagnosing colon cancer and, more importantly, diagnosing and removing precancerous polyps. Approximately a third of men and a quarter of women will have polyps on their first colonoscopy. The strategy of removing these polyps, or adenomas as they're also called, has been proven in large national studies to reduce an individual's risk of developing colon cancer.
Colonoscopy lasts about 30 to 60 minutes. You will be sedated and comfortable for the procedure and given detailed instructions on diet and medications and the laxatives you are to take in preparation for the procedure. This video will review some of the more common preparations and attempt to troubleshoot problems that might occur while prepping for your procedure. You will require a ride home after the test and are advised not to return to work, make important decisions that day, operate heavy machinery, or stay alone. Your doctor and anesthesiologist will obtain informed consent with you directly before the procedure.
The effectiveness of colonoscopy depends a great deal on the quality of the preparation for the exam. A clean colon will result in a safer, quicker, and more effective exam. It will also lessen the chance that your doctor will need to bring you back sooner for a re-examination due to a poor preparation. Generally speaking, you will be advised to take a clear liquid diet the day before the test and drink a laxative either the night before the exam, or if your procedure is later in the day, you may be advised to split the prep, taking half the night before and half the morning of the exam. It's very important that you follow the directions and drink the full amount suggested. In addition to the laxative prep, you should drink plenty of clear liquids. It is also very important that beginning 3 hours before your procedure time, you should stop all preps and drinks and take nothing by mouth until you are given the okay after your procedure. Please note that serious problems can occur if you should eat the day of the exam and not tell your doctor or anesthesiologist.
The following are specific preparations we commonly recommend. Please be advised your individual physician may recommend slight changes in this routine based on your history or previous experience. This video is not meant to supersede those instructions.
Hi, my name's Christy and I'm one of the medical assistants that works at Bucksmont Gastroenterology. I'm going to be going over the instructions for the MoviPrep Bowel Prep Kit. The day prior to your procedure is known as your prep day. The whole entire day before the test, you will follow a clear liquid diet which consists of chicken or beef broth, black coffee or tea, you may have sugar, no cream, Gatorade, water, Crystal Light, water ice, popsicles, any kind of soda, nothing red or purple. The Bowel Prep Kit comes with a container which is divided into 4 marks. There's also 4 sets of pouches labeled A and B. In the morning, the day prior to your procedure, you'll take a pouch A and B and dump it into the container and fill to the top line with lukewarm water, shake and refrigerate. At 4:00 p.m., the day prior to your procedure, you'll begin drinking your Bowel Prep Kit. What you'll do is drink down each mark every 15 minutes until finished. Then, after you're finished the first container, you will then prepare your second and last container. You'll take a pouch A and B and dump it into the container and fill to the top line with lukewarm water, shake and refrigerate. At 9:00 p.m., the day before the procedure, you'll begin drinking your second dose of the Bowel Prep Kit. You'll drink down each mark every 15 minutes until finished. You may remain on clear liquids the rest of the evening, nothing by mouth after midnight unless you take a blood pressure medication, cardiac medication, or seizure medication. You may take any of these with a very small sip of water at least 3 hours prior to your procedure. You may use your inhalers as directed, and please bring any rescue inhalers with you to your procedure. The colonoscopy takes approximately 30 minutes. If your procedure is being done at the endoscopy center, you will be there about 1.5 to 2 hours total. If your procedure is being done at the hospital, you will be there about 3 hours total.